Welcome to the 11th episode of 5P Podcast, the first international regenerative medicine and anti-aging podcast that will give you the tools to age with the greatest health, wellness, and appearance. It is directed by Professor Dr. Jaime Rodríguez Quintosa and Professor Dr. Debbie Vinsky. We are your hosts, Sandra Sola and Professor Carlos Galante.
We are at the headquarters of Jerry's Productions Wave Smith Studios, the podcast accelerator that walks you through the steps to create a successful podcast from scratch. We invite you to subscribe to our YouTube channel at 5P Podcast to learn more about this topic. As you will know, we have with us the 5P Podcast ambassador, Professor Dr. Debbie Vinsky, the Queen of Anti-Aging Medicine and President of the World Council for Preventive, Regenerative and Anti-Aging Medicine, WOCPM. Welcome, Professor.
Hola, welcome. Thank you very much. Hola to you, Professor Carlos and Sandra. Well, very happy day today. We have Professor Dr. Careen Schroeter, MSc, PhD. So, the famous Dr. Careen is finishing the PhD in Erasmus University, Rotterdam, the Netherlands Master for Preventive Medicine from Dresden International University, and she also has a lot of published papers in several scientific journals, and she worked at Clinic for Chronic Disease, Kastaninhof, Köln. In addition, Dr. Careen Schroeter was the head of the laser department, Medisch Centrum Maastricht, Anadal. Very famous Professor Careen, also Vice President of the World Council of Anti-Aging Medicine in Paris. Professor Careen Schroeter, thank you for your time, and we like to start this 5P podcast from Barcelona and Vinsky Tower, Jakarta, with the same question to all our guests. Why did you decide to dedicate yourself to regenerative medicine, to anti-aging medicine?
At first, thank you very much to all of you for the invitation. Then I would like to answer this question. There was a possibility to make a decision between the German part or the German-speaking countries and the international-speaking countries for doing the Master in Preventive Medicine. Now, for me, because I didn't live for more than 20 years in Germany, I prefer to take part in the international one because it was a challenge due to culture differences, due to language differences, due to the topics. And actually every day every time we were meeting, it was like a class at the very end, what is looking like now also. We still have contact. And this was a very nice experience to me, making a choice for the DIU in the international part and not only in the German-speaking part.
Thank you
Now,
for sharing.
Then, on as a second, it was important to see that medicine was carrying on and moving. And this is just a part of topic in preventive medicine. You come to know what is in the pipelines. You can develop your own ideas, what you could do in the future. You get new future aspects. You do a lot of research and development. And this was just the beginning of a lot of new ideas for carrying out new research things, to develop new research ideas and also new products. And as such, I always enjoyed taking part in that international part of prevention. Mm-hmm. And on top of it, the places we went to were nice, and I only can advise everybody to take part in this course, also for meeting new people, getting new information, and it is to compare with as a small, limited new study of medicine. This is how I experienced it after all the years. That's it.
Thank you.
Any question asked?
Thank you.
So you have done a lot of research and published many papers in scientific journals, and some of them studying the effects of phytotherapy. there are lots of supplements that promise to boost our immune system naturally in the market, but are they really useful?
This is a difficult question and a good question. The issue is actually, look, we started with the immunology in end of the 90s with laser and light. And we know that laser and light is part of radical oxygen species. It causes this one. Now we were looking how to prevent stress in a lot of tissues and in a lot of issues also going on. That means at that time supplements were not that developed as now. We know that we can prevent with light, depending on the wavelength, several stress for the skin. But you also can perform stress, for example, with blue light in the skin. Now, at that time, there were not sufficient supplements to fulfill these criteria. Then we went on doing our own things and our own research on special therapies, also concerning supplements. But there were supplements only very specialized. There were not supplements completing the whole topic for stress, for example. Now, and coming back to your question, I prefer clearly supplements which are scientifically based, and there are supplements which are scientifically based, but it is also a question of money to get these studies on supplements performed. And to these supplements, you can deal with herbal products, you can deal with biochemical products, whatsoever, homeopathic products, you can deal with products in nanotechnology, and this is what we are doing at the moment.
Okay, so which of them would you recommend? What I mean is, which ingredients must we search to choose a supplement that really enhances our immune system?
Look, what we do need, which is important for the immune system, is to get an anti-inflammatory product and also an antioxidative product. And usually, look, herbs were already used and applied for many hundred years ago, for example, in the Chinese medicine, in the Ayurveda medicine. And as such, we were bringing a mixture together to sort out what it is doing. And this was funny enough before Corona started. And when Corona started in Germany, for example, we figured out that these products as a combination also worked on COVID, on SARS-CoV-2. The COVID-1 was already in the 80s, for example, in Europe, and the older generation, and this was very important, of about 90 plus, has had sufficient antibodies against SARS-CoV-1. And as such, they never got as ill as the 80-plussers, because the 80-plussers haven't had enough antibodies against COVID-1. And like this, they got a more heavy COVID-2. Now to come back to your question, a special combination of special herbs works preventive against inflammation and also against oxidative stress. Now, as such, I'm talking, for example, as blackberries, chamomile, whatsoever. Garlic is one important one, and there are special recipes for this. And what are they doing? The issue of this is hitting the cytokine storm, and this is not valid only for COVID. This was also valid for other viral diseases. And in the meantime, more advanced studies are being carried out.
Great. And do you know any product that has all these ingredients? Like you talk about chamomile, you talk about this. I remember that you talked in one of your lectures about the 5 immune active of V immune active product, right?
Yes, that's right.
Could
Be immune active for the research name.
Yeah.
Now the name is Resilience.
Uh-huh. And could you explain
And
how this
it
immune
actually,
active, yeah, is supporting
yeah, sorry?
this? Could you explain how this V immune active complex is capable of supporting and strengthening the body's defenses through virus, bacteria, and fungi?
The issue is, what are these herbs doing? And these herbs are working anti-inflammatory in the first step. That means they are working on cytokines. They have a good influence on cytokines, which are high inflammatory. And this is, for example, TNF alpha, interleukin 1 beta, IL-6, tumor necrosis factor alpha. There are special interleukins it is working on, and as such, it is hitting the cytokines, this product resilience, which was the immune active in research. Now, and the results are very good because we did pilot study in patients having COVID and having not COVID, but having other viral diseases. And it starts to hit the virus within the first 24 hours. Therefore, it has a very high preventive aspect. Also for elderly patients, or people, the dosage actually needs to be corrected, and also for children. And babies we never tried, and children we just gave it a try from the age of 12 years on. But you see that the symptoms are not that heavy as they are supposed to be in such a viral infection. And even in patients who have been vaccinated several times, we have the patients in the Middle East being on a respirator. We gave these drops to. Even these patients came off the respirator more quickly. But in total, it is working as a type of medical food. This is a better word for it. It is not really only a supplement. It is a type of medical food to provide it works anti-inflammatory. That means it gives less inflammation. For example, in the liver, in the lungs, in the mouth. It starts from the very beginning, taking the drops.
Okay, so in what diseases or conditions is it beneficial besides COVID?
Look, it was just developed or investigated for viral diseases. And by chance, it turned out that it works on corona too. But we think in influenza it will work, also maybe on RS, respiratory viral diseases. We are working on this at the moment. But we know also on herpes, for example, herpes type 1, it works very well. If you have the herpes at the lips, it works very well. Now we think that actually it is covering a lot of viral infections and also a lot of bacterial infections. The patients now, we are for an ongoing study, and this is actually not written communication, shows that it works also on CRP. That means on the C-reactive protein. Like this, or we see, for example, depression and neurological diseases, which show a higher or an increased CRP, which is not a silent inflammation, depends on the lab findings, above 5 nanogram, shows that you even can reduce this. Now, I think if you want to add this product, even to antibiotics, which is positive and possible also, shows a much quicker result than giving antibiotics alone. But again, there are cases for sure you do need antibiotics, and it is not sufficient to apply this product only. But to prevent, it helps a lot.
Another issue about supplements or natural drugs is safety. What can you tell us about the safety of this immune active complex?
Look, the basic studies are being carried out at the University of Oxford at the pharmacological department. This is to state with. Secondarily, it was carried out on mice, and this was and the whole product is developed on nanotechnology. That means if you have several herbs in a product, you get a type of additive effect. And the additive effect just gives the total effect. Now, the product has no toxic reaction. This is also shown by Oxford. And it reacts even very well in mice. And the funny thing was, this first study in mice was carried out in Oxford during Corona. Now, the mice, which were in one cage and fed from one of the people from Oxford, they were very harmless and very calm and very peaceful. And the second effect of this product was it works somehow anti-aggressive. This was the start of all of it. Then we said, okay, if it is like this, what is it doing in neurological diseases, and how can you support neurological diseases? Because we think, or this is the opinion of our whole research group, that inflammation actually causes mitochondriopathias and not the other way around. That means if you remove an inflammation, you also can treat as such a mitochondriopathia because you reduce the stress. And stress you have several types of.
And can everybody take this supplement, or if you have any allergies, it's better not to take that, obviously.
You look, I'm myself, I'm always at the careful side. If somebody is known with allergies against special plants, or he has cross allergies between nuts and special trees, then I would say you have to, or you get it sorted out and tested out. This is one option before. On the other side, the amount of herbs which is in the drops is of that low amount that it will not do any harm. We did not see in all the patients any clear allergic reaction, because I'm very allergic myself on garlic, for example, and then you see this after a few days and you get some symptoms as paresthesias whatsoever, you have to stop.
Okay.
But usually the patients, if they are informed very well, and if they have a lot of problems from food allergies or other sensibilities, they know themselves which they have to take care of. And then I would advise better not to take it.
Okay.
But it's not like this, if you don't have a severe allergy, that you should not take it, only if it's really severe.
Mm-hmm. And what about the side effects? Does it have any side effect?
No, we didn't see any side effect. I have had, because I took it half a year because I have an underlying infection of borreliosis. I took it half a year, and after half a year, I got some paresthesias and fasciculations in my leg. But this is just, I did it on a long time run, also being a patient, and to have a look what's going to happen and has it any influence or not. But it is per 99% safe. And also it's diluted in alcohol, and there are no other added materials in it which could promote. Sorry. I have had a patient yesterday dying, that was a family of it. Cut this out. No, but usually you don't see any side effects, and this was a good issue. And the dosage is that low that it doesn't cost anything. If you take it preventive for 1 to 3 months, it should be okay.
Okay. Can you get closer to the camera, because we are losing your voice now?
Yes.
Yes.
Now it's okay again?
Yes.
Now it's great.
And can you put like the camera a little bit down so we can see all your face? Like this?
better?
Like this.
Yeah.
Perfect.
Okay.
Perfect.
Okay.
Yeah, that's because I move on and off. But okay.
Okay. ¿Repito la pregunta o seguimos? Seguimos, ¿no?
No, seguimos,
Vale.
sigue.
We remind you that we are interviewing Dr. Careen Schroeter, MD, PSc, PhD in PhD Erasmus University Rotterdam, the Netherlands Master for Preventive Medicine, Dresden International University. She has lots of published papers in several scientific journals, and she works at Clinic for Chronic Diseases. If you're enjoying this episode, don't forget to subscribe to our YouTube channel at 5P Podcast.
I enjoyed the interview, Professor Careen, and you are very famous with all your scientific papers. And I have a question. You have done a lot of research about this, beside that immune, but the oxidative stress also. Could you explain to our international audience about this oxidative stress, what that is?
Look, we just say stress might be a lot of things. Might be mental, might be working wise, might be due to medication whatsoever. That means the body is reacting to oxidative stress in making radical oxygen species. Now, these species actually can do harm to mitochondria. Now, the way how they do harm, we think about it's caused due to interleukins, due to inflammatory reactions. Now, and this is one important thing also. We know, for example, that aggression also has a lot of oxidative stress. And now everybody is wondering what is happening in the brain. Now, in the brain, even in depressions or major depressions or catatonic behavior, we see that there is inflammation. And then, but in the low-grade inflammation, and we talk about a silent inflammation. And like this, all these ROS species just cause stress in the sense of inflammation. And inflammation again causes disturbance of neurotransmitters, for example, of GABA and serotonin, which we find decreased. And in stress, you have increased, for example, dopamine, adrenaline, noradrenaline. That means stress and also viral infections can cause disturbance of the neurotransmitters.
And why is it important to our overall health to reduce that oxidative stress?
Again, your question, please?
Yeah. Why is it important to our health to reduce that oxidative stress?
Now look, for example, if you have oxidative stress which causes inflammation and you get by this an increase of adrenaline, noradrenaline, you can face problems with your heart. For example, it's important of heart diseases. For example, even in atherosclerotic plaques, because it causes inflammation of the endothelium of the vessel wall, and as such you have a higher possibility of getting atherosclerosis. This is point one. Secondarily, it can cause neurological diseases. For example, we find this in ALS. ALS is full of ROS, and I think this is a big issue because we find a lot of toxins. We were having patients, case reports and patients in the Middle East on ALS, and there is a link between toxins and radical oxygen species, and this is also causing a lot of causing of stress, and this is like a circulation. But there are many issues these stress or these radical oxygen species can cause and can damage the body.
And could you explain which is the relationship between oxidative stress and depression?
Look, there are few molecular possibilities, but there are still also things we are not 100% sure about this yet. But we know that in depression you find inflammation also. An example in Germany, by chance at the place I'm living in, there are studies being carried out on depression and antibiotics. And we found in infectious diseases that many people are depressed. And we were looking for this. Now, when we started to treat these patients with tetracyclines or macrolides, we found that they were improving, and even their depression was improving. Then we did further research on this, and we figured out that depression has a link with stress, and stress may be caused due to bacteria. In this case, it were bacteria, and also due to viral diseases. That means there is one option now going on in our German-speaking countries. Depression also will be started being treated by antibiotics and by herbal treatments, and not only anymore by antidepressants and medication and whatsoever. That means there is a clear link.
Wow.
Wow.
So, talking about depression, usually we use pharmacotherapy to treat mental disorders, and I believe that nothing else is available now. However, many people seem to look for other alternatives like plant-based supplements, and they try to take advantage of them. Is there any research that shows some benefit about these supplements?
Yes, there is a second product from our research group which shows very clearly. We treated PDTS patients after war or who have been in war in Afghanistan, and who are also running in psychotherapy. And if you treat these people with this herbal product, what you see, they are easier to be treated in psychotherapy. That means but only as an additive, not as a medication. You could apply this to post-traumatic distress syndromes patients, and they are quicker to be treated with a medication. It is actually a type of added medication on this. And you are right. And there's a second product, which is now, this was an experimental product too, but it showed very nicely that it works very well too. And on a few patients, we did a type of pilot study.
Okay.
So it seems like it's very clear the correlation between oxidative stress and the immune system, right? Which one comes first? Is that immune system that generates oxidative stress, or it's oxidative stress like active our immune system?
No, I think the last one, what you said, this is what I mentioned before. It is also with mitochondriopathia. I don't think that you have at first a mitochondriopathia and then a reaction of the body. I think it's the other way around, because what we see in chronic patients for many, many years and what we observe is just if patients have somewhere an inflammation or a disease whatsoever, they get mitochondriopathia. And then we have the issue, they get chronic fatigue, they get MPS, and they get chronic fatigue syndrome, for example. And this gives mitochondriopathia. And this is, at the moment, we have a big problem, even in Germany. We can't measure properly ATP. This will be one of the next problems. There is no good test to get ATP measured. And but what you can measure in these patients is all the inflammatory products, and these are not only interleukins, these are also CRP, procalcitonin we do a lot of other things. And then you get a good picture of these things. That means, coming back to your question, it is just that diseases cause problems for the immune system. And what the products are doing, we are looking for, are just rebalancing the immune system. That means balancing the anti-inflammatory and the inflammatory products, cytokines of the body. This is the main issue.
Thank you, Careen. And I think how important it is to manage our mitochondria, the power of the cell, because this is really connected with the oxidative stress and our immune. Finally, as an expert, we want to know what advice would you give to our international audience who are interested in exploring the Phi Immune Active as an option to improve their health or to their patient?
I think, for example, you could take this one or apply this one as a prevention before flu is coming up or before other viral diseases are coming up. And I think this product has even more possibilities, but we are not out of it in total. And I mean with this, I think even on special tropical diseases, it could have an influence. But we have to do and to run for this more studies. But as a prevention, it would work very well, even in nursing homes. We did a request now for a study in this one to support elderly people not to be caught again in nursing homes if there's a new epidemic type of thing is coming. And also at the time of Corona, we wanted to start studies with this, but everybody was so full of vaccinations that we just left the idea for the time being and said, okay, later on, as soon as we have more results, it is better to retake the topic again. But it would have been a nice issue, and I can imagine it would have decreased a lot of symptoms in patients who got corona. Because the patients who really got corona have had a disbalanced immune system. If this immune system would have been okay, this also includes their bowel system, the microbiome of the bowel, then they never would have caught bad symptoms or severe symptoms of corona and of other diseases.
Yes, and I think it's very important to exploring this Phi Immune Active for the future to prevent another attack. We never know, right?
Yes.
Thank you. Thank you very much,
I do
Professor
agree,
Careen.
yes.
Today, yeah. Thank you. Today we have interviewed Dr. Careen Schroeter, MD, MSc, PhD from Erasmus University Rotterdam, the Netherlands Master for Preventive Medicine, and Dresden International University. She has a lot of published paper in several international scientific journals, and she works at the Clinic for Chronic Diseases, Kastanierhof, Köln. In addition, she was head of the laser department, Medisch Centrum Maastricht Anadal, and she also vice president of the World Council of Preventive Medicine, expert in autoimmune disease, and many, many other expertise to come. Thank you very much, Professor Careen.
Thank you also, all of you.
Thank you.
Thank you.
Thank you for listening and supporting this initiative. We invite you to subscribe to our YouTube channel at 5P Podcast. If you want to learn how to make a successful podcast, subscribe to Wavesmith Studios on YouTube. See you next time, and remember, take care of yourself today to defy time tomorrow. Thank you.